A new report by the Institute of Development Studies, a UK-based think tank, has placed Nigeria as the second poorest country in the world in terms of food affordability. There are also indications that many Nigerians could suffer a lack of key nutrients from protein-rich foods due to an increase in prices of these basic food commodities. And Kemi Balogun reports.
Adama is making a meal for her husband and children. Her family live in one of the slums inside the highbrow Asokoro area in Abuja. Lately, her meals are not as rich as they used to be, but it is the best her family can afford. Her children play with others, patiently waiting for when food will be served. They remain oblivious of the current economic realities that deprive them of a healthy portion of protein in their meals. Market forces have pushed up prices of food commodities, especially protein-rich food, making it increasingly difficult for Adama's children and other children from poor families to get a healthy, balanced diet.
There was a time when my children eat eggs, but now we cannot afford it. It is no longer in their meals. Things have really changed. Beef is expensive. Rice is no longer cheap. We spend more to buy little food.
A recent survey carried out by Premium Times, a prominent online newspaper in Nigeria, showed that the price of all food items have dramatically skyrocketed, and the cost of protein-rich foods rose by an average of 60.5%, while carbohydrates rose by 59%. Emmanuel Buga says weak government policies and over-reliance on food imports has further weakened the economy and critically impacted food prices.
Food prices ordinarily will affect virtually every other thing, because among the needs that are required in an household, food comes first. But more importantly, to over 89 million Nigerians that UNDP says they are living under multidimensional poverty. When food prices are high, labor will find it unreachable to purchase. Also know that they have to spend on transport to get to places of work. So the importance of food prices, manageable food prices cannot be overemphasized.
Another report by Doctors Without Borders, published in June this year, shows that there is an alarming rise in preventable illnesses associated with a lack of food. The data shows that in the first 4 months of 2021, there were more than 10,000 children in Anka, Zurmi, and Shinkafi IDP camps in Zamfara treated for severe acute malnutrition and other preventable diseases. The International Medical Association warns that rising violence in northwest Nigeria is also causing a humanitarian crisis. Most malnourished children lose out on basic components that provide the necessary minerals and vitamins to help them develop effectively. Protein is a major component of the skin, muscle, bone, organs, hair, and nails. It is an important part of any diet. It makes up the part of every cell in the body because it helps the body to build and repair cells and tissues.
It is very crucial and it's very important that every functioning human being consumes proteins. Protein, in essence, is extremely important.
This bustling community market in Pape, a suburb in the nation's capital, is where many low and middle income earners come to buy food commodities. Nigeria continues to rely heavily on imports for almost all food types, and this continues to threaten its target for food sufficiency. Government's efforts to lift more people out of poverty may not have yielded much. It also seems achieving Goal 3 of the Sustainable Development Goals, that centers on good health and well-being, may still be an impossible task. Kemi Balogun, TVC News, Abuja.